One way of handling cancer, the way I learned about it was very interesting. When I was traveling in China, I found out that there was a case in a very remote area in China, and the kid was a 7-year-old kid with osteosarcoma in the hip. And as we know, there's really not very good treatment for it. Sadly, this is in a very remote area. And the kid was destined for a very ill fate. So in desperation, the family found a doctor who turned out to be a retired doctor from the army who's really an orthopedic surgeon. And of course, as we know, hip replacement is a dime a dozen. These operations are done so successfully nowadays. It's really an easy thing to do. And this orthopedic surgeon decided to do something that's literally groundbreaking. And this is a story that's not published or anything. And when I heard about it, I went in and talked to this guy and taught and interviewed the kid. It's just incredible. What he did was he took the hip out of this kid, the hip, just like a hip replacement. And he threw the hip into a pot of boiling water and he cooked the hip. And after much cooking, he actually dried the hip, and he put the hip back in, just like a hip replacement. So instead of replacing it with a piece of prosthesis, he's replacing it with a piece of cooked hip. No big deal. It's perfect fit, because how can you find a better fit? And guess what? Of course, he drew some bone marrow from the other hip and stuck the marrow into the center of this prosthesis, the cooked hip. And the kid lived. There's no cancer. And today the kid is still alive. So it prompted me into a very interesting therapy called hyperthermia treatment. Anyways, when I traveled to Japan, I found out there was a Dr. Niwa who has a wonderful hospital that does nothing but alternative cancer treatment in the southern part of Japan. And one of the treatments that he mandated his patients do is to bury themselves in a pot of hot sand once a day for 8 minutes. And it's so hot that when I was buried in there for 8 minutes, my whole body was throbbing. So I said, if this is not going to cook the cancer, what is going to? Of course, if I was ready to import some of its magical sand that can retain the heat to Vancouver, but I thought the health department might not like it, because I was just about to do what I didn't want to do when I was buried in the hot sand pit, So I said, gee, what am I supposed to do? And wonderfully, I came across something called peat hyperthermia therapy, that I can use some peat preparation, because as we know, peat has a very high molecular weight and is a carbon complex that's made from hundreds of, or at least 40,000 years of fermentation of vegetation from the center of the earth, that can absorb the heat very efficiently and release the heat very slowly to basically cook whatever's in the heat. That's how come you can have a fire in a bog and you can never put it out, because of the high efficiency of storing the heat. Anyway, so what I've done nowadays, incorporated in the cancer treatment, is to make patients go through this peat bath therapy. So I built a whole bunch of 4 7-foot bathtubs, and I'll get the staff to adjust the bath temperature so that it's at 110 degrees Fahrenheit, which is very hot. And usually when you step into a bath water that hot, you're going to get scorched. So when we mix this peat material into the bath water, when patients step in, there's no problem, as long as they stay still. Of course, someone has to be there to monitor their heart rate very carefully. As soon as their heart rate reaches 120, we'll pull them out and we'll, wrap them up so that they can rest. And of course, because of the raising of the core temperature, I know, because they will sweat profusely for literally anything from half an hour to sometimes up to 2 hours. And I know that I can raise the core body temperature up to at least 39 and sometimes 39.5 or 39.8, pushing it for the strong guys. We managed to raise it to 40 degrees Celsius, which is very dramatic. And we know that heat can induce the white blood cells in our body to produce a protein called heat shock protein, especially heat shock protein 46. We know that this is very instrumental in helping our immune system attack the cancer cells. And so this is a therapy that we do in our clinic. In coupling with that, we also do excorporeal alpha interferon natural killer cell activation. So what we do is, while the patient is being heated up in an infrared chamber, we will do phlebotomy and let out 200 cc's of blood. We will mix this blood with alpha interferon, and the blood is infused back into the person while the person is undergoing this hyperthermia treatment. Of course, the core body temperature might not rise as drastically as the peat hyperthermia therapy. And of course, in our clinic, we also do photooxidation ultraviolet light therapy. I use a unit that I brought over from China that the ultraviolet light source literally heats up to about 300 degrees Celsius. Of course, we're going to need all kinds of fans blowing on the blood bag to make sure we don't cook the blood. And at the same time, we have an ozone flow by to ozonate the blood continuously for 15 minutes. We have treated a number of non-Hodgkin cases quite successfully without chemotherapy. I wouldn't say I would use that as a primary treatment for a lot of non-Hodgkin cases, but when the odd case when we see fit to put them through a course of treatment, we have seen very obvious reduction of the size of the lymph nodes. Anyways, other than that, of course, we do your ozone treatment, including direct injection of ozone if it's necessary. Of course, it's kind of scary. And we also do rectal insufflation. We do ozone steam sauna, and we also do IV ozone therapy, meaning we mix the ozone we mix the ozone in the blood in a bottle, and we infuse that back into the person. But then again, there's no cookbook approach. What we're going to have to do is we're going to have to take a very thorough history, review all of the clinical evidence and records, and go ahead and do a very thorough survey and investigation in terms of what the immune system is like, what kind of terrain are we talking about, what kind of possible causative agent can we identify, to go ahead and make a decision in terms of what our strategy might be, and go ahead and prioritize very carefully whether we need to attack, support, or which needs to come first in order to lay down the program for the patient and hope for the best. And of course, without closing our mind entirely to some of the more drastic conventional treatments, which could really be part of our alternative treatment, or whether we be complementary or they be complementary. I think it's a matter of what we want to call it, and make it to be the best in the patient's favor.